Hello. So as promised, today we're going to talk about acid reflux, and this is in response to the recall of a prescription drug called Zantac, and it's probably one of the most prescribed medications across the planet because acid reflux is a very common concern. So the active ingredient in Zantac is called ranitidine. So your medication may go by a different name, but check to see if that is the active ingredient, because the reason why the drug has been recalled is that the active ingredient has been found to be contaminated with this possibly carcinogenic material. So this is fairly serious. It's called NDMA, nitrosodium methylamine. That's a mouthful, but NDMA for short. So Health Canada has recalled all of the Zantac or ranitidine ingredients from the market. It's even available over the counter as an acid reflux remedy. So please be careful about what you have in your cupboards. The recall is across North America right now, and possibly in Europe, possibly in France too. So if you go onto the website, for example, for Health Canada, they have a whole bunch of lot numbers and batch numbers listed, and you can check to see if your medication falls into any of those batch numbers. But please do consult with your natural health practitioner or your medical doctor to find out if this is going to affect you directly. Now, I'm going to be giving some advice for natural alternatives for this particular health issue, and I want to remind you that you need to always verify and check. If you're going to change any medication, check with your practitioner first, okay? So don't go out there and willy-nilly do things because you have a pre-existing health condition. And even though I'm trying to give you good advice, I want to make sure that you're getting the best possible treatment. All right, so here we go. So acid reflux. So what's happening? Most people consider acid reflux as a result of too much acid leaking up from our stomach into our esophagus, the lining from our throat to our tummy, and then causing a burning sensation, or in some cases people just feel pressure or they feel like they have a lump in their throat. Right, so actually, very commonly, acid reflux isn't as a result of too much stomach acid. So taking something to suppress stomach acid, prevent our stomach from producing acid, or to reduce the amount of stomach acid produced, may make us feel better, but it may not actually be getting at the root of the problem. In some cases, the little lid on the top of our stomach, it's like a little muscle, closes down when we have food in our stomach. Sometimes that doesn't close properly. And as we're digesting food, acid is splashing up into our esophagus. So why does this happen? Well, commonly stress-related reasons. So stress produces hormones that can cause inflammatory responses, and in some cases it can interfere with how our stomach, that little muscle, is closing properly. So you can do a test to see if you have too much or too little stomach acid. So there's an enzyme or a digestive aid that you can buy in health food stores, and it's called betaine HCl because it mimics hydrochloric acid, and it sometimes comes with pepsin too, which helps to stimulate our digestive juices. So you can take this as a supplement with your meals. And if you find that this remedy then makes you physically feel better, as soon as you take it, your digestion is better, you're feeling less gas, less bloating, you're not getting any more reflux, then guess what? You don't have a problem with too much, you have too little acid. So that's one way to test it. Of course, if you take it and you feel like you've just added fuel to the fire, then there are other issues happening. So that's one way you can test, okay? And you can do that with the help of your practitioner. But the remedy is actually naturally available because it's a naturally occurring ingredient. The other most common reason why people get acid reflux is an evil little bacteria called Helicobacter pylori, H. pylori for short, and it burrows its way into our stomach lining and creates ulceration, and then there's stomach acidity and irritation as a result of it. So if you go to a medical doctor, they will give you an antibiotic that's specifically for treating H. pylori. Now, in the natural realm, there are some natural alternatives for treating H. pylori. So there is a gum from a tree, and it's called mastic gum, and you can get it in an extracted form, and it can be used for treating H. pylori, so it can help to kill off that bad bacteria. There's also a honey called Manuka honey from New Zealand that you can get in a nice high dose, like an MGO 515 or so. You can also try using that as a treatment for killing off that bad bacteria and helping to speed up the healing time. Right, so that's to specifically treat the bacteria that's causing the damage. Now, what can we do for healing, and what should we do for relieving symptoms? Because healing takes time, and we need something to relieve the burning or the discomfort right away. And we want to protect our esophagus because we don't want to end up with damage to the lining of our esophagus, which can potentially become cancer, right? So it's very, very important that we treat this. We don't just leave it alone and hope for the best. So there's an extract from licorice root called DGL, and it contains all of the active ingredients in licorice root minus one. There's an amino acid called glycerin, and glycerin may elevate blood pressure in some people who are prone to high blood pressure, so it's removed from the root extract. So the DGL comes in a capsule form or in a chewable form. Now, ideally, I want to give people a chewable form because what it's going to do is it's going to create a barrier along the lining of your esophagus. It's going to calm down that sensation of acidity, so it'll give you quick relief, and you would chew it preventatively or prophylactically before your meals. If you do get a reflux symptom, you can chew it right away, and usually within 15 to 20 minutes, it'll calm down. You'll feel better. The other great thing about DGL is it's not just palliative. It does have some healing properties to it. It helps to stimulate healing the lining and the mucosal lining of our esophagus, our stomach, and even our intestinal lining. Now, if you think that licorice root tastes vile, and some people do, they think it tastes like poison. I laugh at people when I give them samples to try. If you think it tastes disgusting, it does come in a capsule form. Now, I will warn you, there are companies out there that add flavoring agents to the chewable form of this licorice root extract for those people who dislike the taste of licorice. So there's a downside to this. When you add a flavoring agent, some of the flavoring agents can actually trigger inflammation. Some of these products have artificial sweeteners in them or sugar alcohols, which may disrupt your friendly bacteria in your gut. Some companies even flavor the chewable licorice root with chocolate, and we know that chocolate inhibits the closing of that little cap on the top of our stomach. So you don't want a chocolate flavored licorice root chewable because that's just defeating the purpose. So if you absolutely can't stand the taste of it, then get the capsules, all right? And it will help with healing the lining of your stomach. All right, so when it comes to healing, there's a fantastic form of the zinc mineral called zinc alginate, and that helps to stimulate the cells to repair in the lining of the stomach. Right, so that's a very important ingredient that you want to see in your anti-acid or reflux medication or natural remedy, actually. So this is a natural thing that you can get in a supplement form, zinc alginate. Now, when you are treating acid reflux, you also want to calm down some of the other digestive symptoms. So you can use things like ginger or chamomile because it's soothing, and in some cases people will feel nauseated, and the chamomile helps with nausea, and so does the ginger. It's actually quite effective. Now, there's another barrier method, so we can create a barrier and prevent the acid from leaking up from our stomach into our esophagus, and it's called sodium alginate. And so sodium alginate acts like a gel, and it literally, kind of caps things so that the acid can't leak up. So that's a good one to see in an acid reducing remedy as well. So all of these things are to kind of get around antacids, or what we call proton pump inhibitors. If we pop antacids or anything to suppress our stomach acid for long periods of time, you are going to create nutritional deficiencies. You're not going to digest or convert certain vitamins effectively if you don't have enough stomach acid. Things like calcium, minerals that require a higher level of acidity will not be absorbed properly. So ladies, when you're trying to protect your bone density and you're popping antacids, that's not a great way to relieve your symptoms because you're creating other problems. All right. So lastly, and most importantly, probiotics. So there are specific probiotics that you want to see in a supplement or take along with your acid relieving remedy. The number one product would be Saccharomyces boulardii, and it's a probiotic that's formulated from yeast. And we know that it actually helps with suppressing H. pylori, so the Helicobacter. So it helps us to kill off that bad bacteria faster. And it also protects our resident good bacteria. And we want to do that because friendly bacteria help to lower inflammation. So this is all part of helping to create this environment where we can heal our stomach nicely. And lastly, a mineral called potassium nitrate, which stimulates nitric oxide, and that also helps with keeping that inflammation down. So all of these things can be purchased separately. You can even get them in a supplement form in combination. Of course, I will make some advice for the remedies that I like to recommend. I'll send some pictures at the end of this video so you'll be able to see some of the product shots. And keep in mind that none of these companies are sponsoring me. I'm not getting any kickbacks from recommending them. These are just really well formulated products that are well tested. They do independent batch testing, research and development, and great quality control, and also a great reputation. Well, I hope that this video was helpful, and that if you have any questions or any further concerns, please drop me a line, send me a message on this YouTube video. And if you found this helpful, please click the like button. And if you'd like to continue hearing more about natural remedies, alternatives that you can use, things that you can do to improve your health and well-being using traditional remedies, consider following me and subscribing to this YouTube channel. Thank you so much for listening. Keep well, and I'll speak to you soon.